It's Ed, and I'm back with my bestie and co-author, Cris Ross. Hey, we're talking about Diagnosed, A Book is Born. And in episode 1, we covered just who's Ed Marx, Cris Ross, and how they become friends. Episode 2, we covered the worst part of it, which was getting cancer, and we both got cancer almost the exact same time, at least that we were diagnosed and had surgery. And now we're going to talk about, so how did the book come about? And so, Cris, tell us a little bit about how the book came about.
Well, as I said earlier, it was really your idea, Ed, and I really appreciate it. And I think both of us were on fire with this idea of we were treated at two of the best hospitals on the planet, and we had good experiences, but they weren't great experiences. A healthcare journey is really, really hard, and there's things we learned. And when we met other colleagues, including like clinicians who treated patients every day, and they would say, wow, I didn't really understand it until I became a patient, and now I understand it better. So I think we were both really on fire to kind of talk to our colleagues about that. And along the way, we got connected with Mayo Clinic Press, who's our publisher. And the editor there, Nina Weiner, said, she really wanted us to focus on a book for patients because that's who we were trying to help. And we agreed to do that. And so we've got the book Diagnosed, and then we have a booklet, which is how to improve the patient experience, which is some of the excerpt material that came from our original vision that is really written to our colleagues. And I think we're happy with both. Hope they're helpful.
Yeah, well, in episode 4, you'll find out, our audience will find out kind of our secret sauce, why the books are actually pretty decent, a lot more decent than they would have been otherwise. But yeah, I'd already written a couple books. And like you said, Cris, we're like, if we had this experience, which was good at premier institutions, imagine what it's like, though, for the average person who doesn't have a nurse in their family, a clinician to go to, or an administrator to go to, and how scary it is, right? Because we were both scary, and we're in healthcare, and so we're like, wow, we need to make sure that good patient experiences, great patient experiences, are equitable for everyone, regardless of their role, their zip code, their socioeconomic status, all that kind of stuff. So when we went out to write the book, you and I, knowing that we represented a very specific demographic, and we can't relate to all the others, we went out and did focus groups, and you and I conducted many of them together with very specific patient populations, which we can't personally relate to, but we can relate to the concepts. And they were great and fabulous. And we learned a lot. And then we learned a lot from all of our CIO colleagues. And so, so I actually have show and tell, Cris. So I have the book Diagnosed.
There it is.
And that's the one that, yes, thank you, Nina, for being the instigator to make it for the public, for patients and their families. And then we created the booklet, sometimes known as a white paper that you can download. But it's, patient experience. And I'll put these in the show notes. We do have a website. You can pre-order the book and you can download the booklet. And all the royalties from Cris and I, from the authors, go to Cure Cancer. So we finally got our cancer fund set up, some sort of fund set up, Mayo Clinic Foundation, and super excited about that. So we're like big into promoting this book and selling this book because we know that every dollar will go towards curing cancer. So no one has to go through what we had to go through. And
well, Ed, our royalties will not be amazing, but I agree with you. But to me, the main thing is, I really want to get our book into the hands of patients and caregivers who are going through tough journeys. Because, you and I had our own experiences, but we also have taken care of family members in different health systems. And I think we both have some firsthand experience that, it varies based on where you get.
Yeah, and Cris, like we've talked about also before, is that experience may not be the main reason for a patient's outcome, positive or otherwise, but definitely can be an accelerator. And so, the more we get people involved in their healthcare and proactively in their experience and things that the book talks about, and also raise awareness for our peers and our colleagues, I think everyone will be better served. So that's really the heart behind the book, as you mentioned. All right. Well, that wraps up episode 3, Cris. In episode 4, as I alluded to, we will bring in part of our secret sauce to make our writing a little bit better, or a lot better, and join us then. So that concludes episode 3. Cris, Thank you for being part of Diagnosed, A Book is Born.
My pleasure, Ed. A joy. And on to episode 4.